Welcome to the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Join us as we dive into inspirational stories about our caring and capable associates and their commitment to guiding healing journeys for our patients. Our discussions explore the important ways VCA Animal Hospitals proactively supports the future of veterinary medicine through leading the industry in medical excellence and providing hometown care to our communities. On today's episode, I'm happy to welcome Dr. Christine Santiago. Dr. Santiago is a VCA Regional Medical Director for the Mid-Atlantic Group. Hi, Chris. How are you today?
Hi, Marie. I'm very, very good on this beautiful day.
Excellent. So I want to jump right in, and I'd like to know what your journey has been in veterinary medicine, and when did you first know you wanted to be a veterinarian?
Well, mine is a rather classic journey, I believe. It was when I was a child, and my father was a chemistry professor. My mother was an animal lover, and that combination was enough to have me find out how great science was, and just followed the path through all my schooling and, came up with wanting to go to a veterinary school. So did the undergraduate at the University of Maryland for 4 years in animal science. And it was a veterinary tract. So I had veterinarians as counselors, which was wonderful. And then got into the University of Pennsylvania veterinary school and absolutely adored it. It was exactly where I wanted to be, and spent the 4 years there and then headed out into practice into Pennsylvania, working for 10 years as a primary care doctor, and then bumped into VCA.
Oh, excellent. Well, I want to hear a little bit more about the VCA, but before we go there, you were very lucky to have a dad as a chemist, because I struggled in chemistry. Was chemistry easier for you because of that?
He was kind of just a call away.
Okay.
So when I was especially, I had chemistry when I was in high school, but I also had it, of course, in college, and took everybody that knows this, as you're trying to get into vet school, you take all the chemistries.
Lots of chemistry, I know.
Yes. So, but was there phone calls asking questions from my father? Yes. He actually published a teaching audio tutorial for chemistry.
Wow.
And he was a great teacher, and it was really neat and it was inspirational. But when I really started to dig into the content, I just loved it. The biology and all of the science and the animal information. It was just great. And my mother, she always had a dog or two dogs or a cat or two cats or all of the above. And she showed me the love of that. And she had great bonds with those animals. I mean, she was the best example of that, the love and the fun that you can have when you get to be with a pet.
So tell me about your practice before you joined VCA, or when you started. Were you with the same practice, or did you change positions and work in different practices?
I worked in different practices because I was just trying to find my center as a new graduate in the first year. That first year, it came down to money. I hate to say it, but it came down to I needed to live above a practice in my second year to be able to pay school loans. So I got free rent, but I would do their emergencies and then also work for them during the day as a primary care doctor. So I was able to get through those early times financially by just trying to get through the system the best I could. But I was recommended by one of the doctors who was a pathologist at one of the practices, and he recommended me to a really nice practice in Lancaster, Pennsylvania. And I got there, and it was an AHA certified, beautiful, privately owned, well done. I was impressed. So I worked with them for a good 3 to 5 years. Then I met my husband and ended up heading up to Bethlehem, Pennsylvania. And then up there, I eventually did a little part-time work, but I would do 2 practices at a time, et cetera, et cetera. And then finally came upon Northside Animal Hospital. And Northside was a beautiful primary care, AHA associated, and also 5 doctors. I was looking for a large practice. I came in for the first year and loved the practice, loved the owners. The owners liked high quality medicine. We actually had a dental specialist come in regularly, which was great. And then 1 year later, VCA came in and purchased the practice.
Okay. So that started your VCA journey.
I was excited about it because I was reading about VCA and learning more about it. And I thought, wow, this is going to bring some great opportunities, for our medicine and everything else. But I was asked to be a medical director for the practice. And I was at a point in my life where I felt like that would be fun. The leadership and the ability to be able to work with a team and make medicine happen, wonderful medicine. So I was really excited about that. So I took on the medical director position. And I did that for 12 years there.
When you started that role, what was the most challenging thing for you?
Those early periods of transition, becoming a new leader, I was really a new vet there too.
Right. Okay.
So people didn't know me that well yet. So that early phase of leadership, trying to make sure that they knew I was here for them and that I really was looking forward to working with all of them, not just the doctors, but everybody, all our technicians and everybody that was part of the team. So it took a little while. I did have a group vice president who was very helpful. He was very good at leading, and he did help train medical directors too. So between that and just being excited about the opportunity, over time, it started to go well. And we retained our doctors. We had a nice little 5-doctor practice. And I added all of the leadership pieces in that were requested, but also that were natural. Communication pieces, the meetings, bringing the medicine in regularly to get everybody educated and have fun with the really good topics that veterinary medicine brings on.
How did you go from being a medical director in your practice to becoming the regional medical director for the Mid-Atlantic group?
So like I said, it was 12 years into the medical director role, and I approached my GVP and I said, I love this, and I would like to have more opportunity to impact the medicine that we all practice. I've been seeing clients, at that point I was 23 years into practice, and I loved it. I loved primary care. I loved the relationships you could have with your clients. Those partnerships were just so much fun, and seeing the patients even more fun. That's the most fun. But I did see VCA as a situation that will allow all of us to bring good medicine and spread it far and wide. And these didn't exist before, an area medical director position for me. And with my medical director skills, I worked with 5 practices. Most of them were new hospitals that we had in the VCA family. And I went to visit them. And with my medical director skills, I worked with the new medical directors in each practice, as well as the doctor teams, and just started to get into helping them. So I spent about 15 years total as a regional medical director. 3 of it was in the Northeast. The rest of it was in the Mid-Atlantic group.
What were you really impressed by with what was happening in the different practices? Did you learn things that you took back to your practice and said, oh, that's great, as well as seeing things to help them in their practice to provide good medicine?
I did bump into some excellent doctors, but I also bumped into situations where I knew there was an opportunity for learning. And as far as what I took back was how important it is for the leaders of the practice to bring the group along. It takes a really strong leader. And sometimes we had to help with that situation and train and teach and try to help them with their culture. So really for me, it was that leaders can impact a practice and a culture. They have to be the one that shows it every day in the actions and words that they provide.
You have long been a champion of early disease detection and wellness testing. I know that started as a specific program within VCA. So when did that program start, and why is wellness testing so important?
It started when Dr. Todd Tams was our CMO, and he basically created an entire initiative around it. And it was a great part of being a VCA doctor. It became part of our fabric. So it was very, very important because we can't take for granted when we have a patient in the room that everything is fine just because we all think it is just by looking at the pet. It is very important to not only do that full physical exam in front of the client so that they can see what we do, but also get a good history, be a good doctor, then understand that what you see in front of you may not be the whole story. And blood work, urine samples, radiographs, those give you the rest of the story.
Mm-hmm.
And that's very important for not only the patient, because for patients, if we can catch all this stuff early and make them feel better and or catch them before they don't even feel bad, that's fantastic.
Right.
Almost all of them appreciate having that underlying information about their own pets. And we take that information and try our best to get them comfortable as fast as we can, to understand what they're going through, and to be there for them the rest of their life if we need to do follow-up care. Say we diagnose something chronic. So if we can cure it right away, we want to do that. If it's something chronic, we're with them. We want to be with them for the rest of their life and set up a good, regular cadence of care to make sure that we catch it all before it has any chance of creating a critical situation.
Yep. So important to make sure that we can give all of the years possible to every client for their pet and make sure that they're happy and healthy and feel well during that time, even if we are dealing with the chronic management of a disease. When we talk about wellness testing, is it always the same set of tests for every patient, or does it depend on their age?
It depends on their age. So in the younger pets, and I will say when we first rolled it out in the very beginning, any pet less than 7 years of age at that point in time, we were doing a shorter group of tests. As they age after 7 and as they get older, then we begin to add in larger chemistries and more comprehensive testing because we know the things are going to start happening. We're looking at hormone, thyroid information, white blood cells, chemistries, that kind of stuff. And we're adding radiographs, chest radiographs, and abdominal radiographs to get that extra information that can be very, very useful. So as they get a little older, we look at a little bit more and we deep dive a little bit more too, because we know we're likely to bump into something that we need to address.
Yeah, and there's been a few literature sources, studies that have been published over the last 5 to 10 years or so that, as I recall, they show up to 25% of the time in pets that are healthy according to their owners, that disease processes can be found on this testing.
Yes. Those were the Ghent University studies. There were 3 of them done.
Yep.
The first one involved 100 cats, the second 100 dogs. And then they did some follow-up on the cats in just recently this year.
Mm-hmm.
They definitely identified illnesses. And on the second round, they found things that they hadn't found before, just going out 2 years on some of the patients. So all 3 studies definitely indicated that underlying diseases were found with the testing that was provided. And things in animals that were not showing clinical signs were identified. We can find things way before the patients tell us clinically or by their own, signs of happiness or not, that there's something going on and we need to be there for them.
You and I have also talked about some examples of pets that were apparently healthy but had important findings on their early disease detection tests. Can you run through a few of those examples for me?
Yes, when we were working with our doctor teams in the Mid-Atlantic, I gave them a little homework, and this was a few years ago, but because we've been doing this for a while, but we had some cases that they put together where they identified underlying diseases. Some of the diseases that were identified, for instance, we had an 8-year-old dog that came up on blood testing with an high calcium, and that dog had an anal sac tumor, an apocrine adenocarcinoma that led to the elevation of calcium, and it got removed surgically, and the calcium actually went down. But there are a lot of things. If you don't catch those early, they can be invasive and difficult to work with. So
you can't fix them beyond a certain point.
Exactly. You do. You get to a certain point and you're in trouble. So I had one case that was a cat where they were doing just, again, some senior wellness testing. Everything looked pretty good. The BUN was maybe a little high and the creatinine a little high, but they saw protein in the urine and it was very high. And it led to doing blood pressure testing, which really should be added to regular testing for our wellness patients.
I completely agree.
Yeah. And hypertension was identified in that cat, and they went ahead and got medicines on board and then started regular follow-up to try to keep the blood pressure under control for that cat. adrenal masses have been found with the underlying changes that can occur on the blood samples. One case where there were other numbers on the chemistry that were up, but the serum alkaline phosphatase, the SAP, was high. On this particular case, they found an adrenal mass, and they actually had a surgical removal of the mass too. And the dog did well.
Yeah, it sounds a lot like human healthcare, that regular screening and identifying things that are not necessarily apparent just on a physical exam. And x-rays the same way. Dogs and cats don't frequently get lung tumors because they don't smoke, so they don't have the major risk factor. But they can occur, and until they get quite large, often there are no clinical signs whatsoever for those. So taking regular chest x-rays in mature adult and senior pets can help us to find something that, again, surgery may be able to cure, or we can identify what is it that we're seeing and what do we need to do to treat it. Well, Chris, we're nearing the end of our time together. And one of the other reasons I asked you on the show is that I know that you are approaching your time of retirement. And I will first of all say congratulations. That's a great milestone. And I also will miss your expertise and your perspectives on the Regional Medical Director team and appreciate everything that you have done for us. You have any plans for your retirement?
Well, thank you, Marie, first of all, for all of that. And I wish I could tell you I did. But this was just, the retirement was something that my husband and I had already made plans on. We knew when we were going to do this, et cetera. So no real plans, just kind of, looking for the next thing to think about. I am a veterinarian at heart, and it was 38 years of being a veterinarian. And so potentially somewhere down the line, there'll also be some little thing that I could maybe still do to contribute to the medicine or pets, in general. So no major plans right now, just going through the process and excited about, what the next chapter is. The past chapter was fantastic. I am so grateful for VCA. I can't even tell you. I can't believe I was so lucky to bump into them in my life. And it really did change my path and made it wonderful. And it gave me the opportunity to contribute like I wanted to medicine.
Mm-hmm.
We know that we try very, very hard and work for great medicine at VCA. And that is just one of the things that we're all very focused on. And it aligned very well with what I agree with and how we can contribute to our patients, which we all absolutely adore.
Mm-hmm.
And their people, because we know what it's like to be them.
Yes.
Pet owners and our teams too. Hopefully I think we grow the members of our teams very well because of our dedication to high quality medicine.
In closing, what accomplishments are you most proud of during your time as a regional medical director?
Well, Marie, there have been a few, but the first one is when I first came into the regional medical director job, dentistries were done. Yes, we had the ability to take a dental radiograph, and we did it mostly either pre-extraction on one tooth or post-extraction to check to make sure that everything was well after the extraction. But it was brought up that the standard of care should be full mouth radiographs to be done prior to doing your dental work. So you have a better idea of underlying disease. So we worked really hard as a medical team in the Mid-Atlantic to train up our technicians to do and perform the full mouth radiographs and train up our doctors to interpret and evaluate the full mouth radiographs. And we spent a lot of time, we did some labs, and we added that in, and then we got it to be, actually it's now a standard of care with all of our hospitals, and we actually have metrics on it that we know we're very much so. We're close to 80 to 100% of our dental procedures are being performed with the addition of a full mouth radiograph.
Wonderful.
So I'm very, very happy about that one. And then we've already talked at length about early disease detection. And that one I'm very, very proud of because you had to take that baton and keep on, rolling with it.
Yep.
And we're doing it. We continue to do it. And I'm very, very proud of VCA, very, very thankful to them for all the opportunity. And I'm thankful to our teams for actually doing it. That's the most wonderful part of this, is that we have changed the standard of care for dentistry, and I believe for wellness work, by making sure we stick to our guns on these. And those are both early disease detection modes when you think about it.
Yep, absolutely. Well, Chris, it has been an absolute pleasure speaking with you. I will miss getting to work with you as closely, so you'll have to keep in touch in your retirement. And thank you for everything that you've done for our patients and our clients and our veterinary teams in your role as a regional medical director.
Thank you, Marie. I truly appreciate it.
Thank you for listening to today's episode. We hope you enjoyed it and learned a few helpful tips. If you haven't already, I encourage you to subscribe and listen to our previous episodes to hear the many valuable insights and lessons from our past guests. Don't forget to leave a review for today's episode and share with friends. Make sure to follow VCA Animal Hospitals on LinkedIn, Facebook, and Instagram to stay in the loop. For more inspiring stories, visit our website at vcavoice.com.